I suffer from under eye bags and looking tired all the time. My question is, how do you decide when a patient needs surgery or just filler?
So that's a great question, and the short answer to this question is, if you think that you have under eye bags, which is the puffiness that some people notice, then chances are you're not going to benefit from fillers, and fillers actually can make the condition worse. So if there are bags, we usually do surgery. Typically speaking, surgery is a much more long-term solution to all of these things, although the recovery is a little bit longer, but it's a much long-term solution. So just a few things about fillers. Not everybody is a candidate for fillers. I would say maybe 20–25% of patients are candidates for fillers. And the process involves a really in-depth history. So when I see a patient, I go through a bunch of questions. What kind of diet you have, what kind of sleep habits you have, what are the fluctuations in your symptoms? Do you wake up in the morning and all of a sudden your eyes are puffy versus it's always the same? And the subjective part of how you see it, some people see their lower eyelids as hollow and some people see it as puffy, and every human being is different. So every human being's anatomy is different, their history is different, their physiology is different. So all of these things come to effect, and then at the same time I sit down and do a full exam, and that exam involves measuring a bunch of things, looking at things, the anatomy, some of the physiological changes, how has the aging process affected some of the things we look at, and then together we come up with an answer to it. But honestly, what I'm seeing as what I call an epidemic is that a lot of patients are getting fillers for the wrong reasons, and they're really not candidates for those procedures, especially around the eyes, which is a very delicate anatomy. So what we're seeing are these problems that we never saw before. For example, 10 years ago, we didn't have this kind of issue where patients would come in and during surgery, we discover that, oh, they had fillers a long time ago. And believe it or not, fillers last a long time around the eyes. And the enzymes that typically break these products down don't work properly around the eyes. So it's important to understand if, number one, the patient is a candidate for this kind of procedure, and number two, if we are looking at a long-term solution, if we want to address something that's very immediate for a short term, and it's important to understand those concepts when we're talking about fillers and treatments. And the takeaway for this is to make sure you are examined by someone who knows what they're talking about, knows what they're doing. Don't forget, I mean, the eyes are really important. This is, at the end of the day, this is something that your eyes are the first thing people see when they look at you. So it's important to just not go to a place where things are not fully thought through. I hope this answers your question. If you want to be seen in person, we actually love these types of questions where patients send us a 15-second, 20-second video, and I'm able to answer them. And your question is actually something that a lot of other patients want to know about. Thank you.